Welcome to the newest episode of the Lebanese Physicians Podcast. And today we will be discussing the recent surgery that happened at the American University of Beirut Medical Center with the separation of the conjoined twins, the first time in Lebanon. And our guests today are Dr. Houssein Darwish, who's actually an assistant professor of neurosurgery at the American University of Beirut Medical Center. He specialized in skull-based surgery and Parkinson's disease surgery and vascular surgery as part of neurosurgery. And we have Dr. Ahmad Zaghal, who is a pediatric surgeon at AUBMC. He did his medical school at Beirut Arab University, followed by a surgery residency at the American University of Beirut, followed by a pediatric surgery residency at the University of Iowa, and another pediatric surgery and urology residency in the UK. And this episode, as usual, co-hosted by Dr. MohammadAli Jardali. Welcome, everyone.
Thank you.
So first question to Dr. Zaghal or Dr. Darwish is, how were you contacted about the conjoined twins surgery and how did this start?
Hello, everyone, first of all. So I was first contacted about the twins by the Minister of Health, Dr. Firas Abyad. So basically the parents approached their primary physician, and the primary physician approached Dr. Firas Abyad, who in turn approached us. So he contacted us and he asked about whether we are able to do the surgery at AUBMC, yes or no, and if yes, so that we can start the process. And after a few phone calls and, we had a short meeting here at AUB, and then we decided that, yes, we're going to get this patient. So we called them again. We called Dr. Abyad again, and we told him that, yes, we can receive this patient. This happened about 2 months before the twins were born.
So usually those kinds of surgeries have never happened before in Lebanon. So how was the decision made to do the surgery locally at AUBMC and not transfer them outside?
So yes, this is the first time that this surgery has ever been done in Lebanon. So the ultrasound that was done to the patient, the pregnant mother, showed that the patients were conjoined at their lower back. And then we decided that we do have the expertise. We know that we do have the expertise and we are able to deal with this kind of malformation. Yes, it has never been done before, but we are able to do it. We know that we have what it takes to do these procedures. And we know that it will take a lot of preparation, a lot of meetings, and a lot of anticipation of the teamwork and all of that. But we decided that we want to take the challenge and we want to do it.
All right. So you decided to take the challenge, but this is Dr. Darwish now. So what were the preparations for the surgery? Obviously, this took some time to prepare for it before you guys decided on embarking on the surgery.
Yeah, definitely. So as Dr. Zaghal mentioned earlier, so when we looked at the patients first, when we had the ultrasound, intrapartum ultrasound, the ultrasound that was done during pregnancy, and we were able to see this conjoined twins. We ordered an MRI during pregnancy, so the MRI was done during pregnancy. And MRI during pregnancy with the two kids that are really stuck to each other in the womb of the mother, it was really tough to decipher actually which is which and how things are connected. But we had an idea, so we started working on this and started imagining. And it's not easy because the way they are positioned is really tough in utero. So when they were delivered, we were able to do another MRI, and then we started preparing for the whole thing. And for us at the neurosurgically, we had the connection between the two spinal cords at the lower end. And for the pediatric part, the pediatric surgeons, Dr. Zaghal and Dr. Al took over regarding the rectum and all other connection at the lower aspect of the pelvis. But yes, we prepared it very well. We had multiple meetings between us, all the physicians who were involved, multiple times, and we looked at the images over and over multiple times. And we had all the time to do the proper planning so that we have a very good result.
Okay. And how many physicians were involved?
Well, how many physicians? So we had two from neurosurgery, me and Dr. Najjar, Dr. Zaghal and Dr. Al from pediatric neurosurgery. And of course, there were Dr. Yunus as well as Dr. Maruf from the pediatric neonatology and also the anesthesiology people. There were Dr. Mariana Awad and Dr. Zahni as well as Dr. Luna Antoun. There were multiple physicians. So in total, I don't know, Ahmed, what was the number? Do you know
There's
exactly?
also the plastic surgery.
Plastic surgery, Dr. Amir Rahim, right?
Yeah, so we're like 5
we were
surgeons
like 12.
and about like maybe 10 physicians. If you consider the neonatology and the gynecology and the anesthesia and all the residents were involved. I mean, it's a big number.
So it's a pretty big team, multidisciplinary through and through. Can you maybe walk us a little bit through what it was like between the time they were born and the surgery? Were they stable? Were they under monitoring? How was that period before we talk about the day of the surgery?
Yeah. So as a matter of fact, maybe Houssein can talk about this. Baby B had undergone 1 surgery before the actual separation.
Actually,
had a special condition. 2. Yeah, go ahead.
Yeah. So the one of the babies had the encephalocele, which is like a huge cyst or a fluid-filled cavity that was coming out from the posterior part of the head. So we had to repair this. And after that, the patient developed a collection of fluid in the brain, which we call hydrocephalus. So we had to put a tube from the head all the way down to the abdomen so that we drain the CSF. So this was the first part. And Ahmed, go ahead for the other parts.
Yeah. So, I mean, just before we decided on the time of the surgery, that was done around 4 months of age, we were just growing them in addition to the 2 surgeries that were done on baby B. Mind you, these 2 conditions, the encephalocele is not actually related to the connection, so it's separate a little bit. So basically, until the time of the surgery, the separation surgery, we were just growing them and they were fine. They were okay. There were no major events other than the 2 surgeries that Dr. Houssein underwent before the time of the actual separation.
Can you tell us now that we talked about the before the surgeries, can you tell us what happened on the day of the surgery?
The day of.
Yeah, on the day of the surgery, it was, I mean, it was a long procedure, definitely. It took us about 10 hours. I mean, first, we started, the anesthesia team started basically after we positioned the patients. The positioning was challenging, prepping and draping was challenging because, you know, it's like 2 babies connected to each other. So we have to hold them and do the circumferential prepping. It wasn't like a usual case. And then the anesthesiologist tried to place central lines for both babies. That was also awkward in the neck because of the position, but they were successful and things went well. And then the first step was with the plastic surgeons, with the plastic surgery, Dr. Ibrahim and his team. So they made like a flap incision so that to allow for the closure at the ends of the procedure. So the skin incision and raising of the flaps was done with the plastic surgery. After that was done, Dr. Houssein and Dr. Najjar performed their part, which is the neurosurgical part. If you want Houssein to comment on
so after that we had to. So this was really challenging for us, as Ahmad Zaghal was also challenging for them, because we're used to do the surgery in a specific position where the babies are lying prone position. We say that's the belly is towards the bed, and the back is towards us. But we were working from the side. And it's really tough anatomically because we're not used to this view from that side. So anyhow, to make a long story short, we did, after doing the skin incision with Dr. Amir Ibrahim and the plastic surgery team, we went all the way down to the bone. So there was a communication between the bone, the bone of the lower spine from one baby to the other. So we had to disconnect the bone. After disconnecting the bone, there was one dural sac, which is the sac that contains all the nerve roots. It was connected. There was one. We should have 2. So we separated them, and we had to close this. And of course, we separated all the nerves from between the 2 babies. And then we had to close the sac so that we don't have a leakage of CSF. Because if you have a leakage of CSF, this will predispose them to a serious infection or meningitis. So this was also very challenging. And then after that, we disconnected the bone and we disconnected the nerves, and we closed the dura. Then Dr. Zaghal and Dr. Aal started working on their part.
Yeah. So for the pelvic organs part, the internal pelvic organ part, the patients had 2 recti, 2 rectum, but only 1 anal canal. And the sphincter mechanism, the sphincter muscle mechanism, was sort of two mechanisms that are merged together. So that was like one patient had deficient muscles a little bit, and the other one has good sphincter mechanism. So what we did is that we separated the rectum from the system, and this rectum was brought down as a pull-through procedure to give the patient a neorectum. That's for baby B, while baby A kept the anal canal and her rectum. So baby A had the native anal canal and the native rectum for baby A, but baby B, we separated her rectum from the common anal canal, and we brought this rectum down to where the anus is supposed to be, just like we do in cases of anorectal malformation. Again, the same thing. We do operate on a lot of patients with anorectal malformation. We call them imperforate anus, and we were used to this type of pull-through, but this situation was a little bit different because of the awkwardness of the positioning and of the different anatomy. Definitely, we had to repair the pelvic diaphragm and the sphincter mechanism to give them continence for the babies to have the maximum chances of continence later on. Also, the female internal organs were very close to each other. So we had to separate the two vaginae. They were like really adherent to one another. We had to separate them gently, and we had to avoid injury to any of the nerve plexuses, any of the the vessels and everything in that area. And after we're done, the babies were almost completely separated except for the skin, so and the sub-Q. So Dr. Amir came again and completed the incision from the other side, from the posterior side of the twin, and then closed the flaps, and he performed the closure on both kids, and now we have two babies.
What a medical feat! It's fascinating hearing you talk about all those details. Can you maybe talk us through how was the surgical post-op follow-up for the after the surgery?
Well, so post-op follow-up, once the surgery, once the disconnection was performed, the babies were transferred to the neonatal ICU, and then one baby was extubated before the other one. Then later on, we're taking good care of the wound. We had some wound problems, but we were able to control them because it's a major flap and it's a major surgery. But the wounds, we were able to control them with the plastic team and with the pediatric surgeons, with Dr. Zaghal. Otherwise, everything was going pretty well. We didn't have major problems, but this is a long surgery. It's a very tedious surgery. It will take time for everything to heal and recover, and we are on the right track.
So my question for you is, what are some of the complications you look for after the surgery? And are they all immediate complications, or are some of them like complications that occur several months later?
I'll talk about my part. I'll talk about my part, and then I can talk. So regarding us, the CSF leak is really very, very important. If you have CSF leak, then everything is going to be ruined because lots of fluid, and it's a fluid from the brain working around the anus. Risk of infection would be very high, meningitis, and things will not go in a good way. So CSF leak was really very important not to have. With the kids, with the two babies are very small, and you didn't have enough the dura so that we can close it properly. So this was very challenging. And of course, from our side, to have any deficits neurologically, especially the two babies were moving their legs, both legs before the surgery. This was really challenging to maintain this. So this was regarding our part, Ahmad.
So from the pediatric surgical part, major complications that we look for during surgery are injury to the surrounding structures. We have major vessels, the internal iliac, the external iliac vessels are very close to where we're working. There's also injury to the vagina, to the other, and to the nerve plexuses in the pelvis. Also, the long-term possible complication that we observe or we look for is continence. So, want to see how continent the babies are going to be. We gave them the maximum chances by repairing very well the sphincter muscle around the native anal canal and around the pulled down rectum and the other baby and baby B. But again, only time will tell. We'll have to wait and see how they develop and how. We'll have to follow up with them to make sure that they achieve the fecal continence when they grow.
Great. And to the one follow-up question. So if the CSF leak has not happened till now, then most likely it's not going to happen, right?
Right.
Says that
in
the first days, if any.
Great. And then the other part is which twin will have a better, let's say, less fecal incontinence, or better chance, the twin with the original anal canal, right? Not the other twin, or
so anatomically, theoretically, both of them should be able. We're talking about the anatomical part, the anal rectum. Both of them should be able to be continent because they have adequate sphincter mechanism and adequate sphincter around the anal canal or the rectum. They should have decent continence. That said, we know that Dr. Houssein can comment on that better than me. One of the babies might have issues with the mental development, baby B. There might be an issue with that centrally, not at the level of the anal sphincter mechanism level.
Yeah, so because one of the babies who had an encephalocele, and we did 2 surgeries before the separation. This baby, she has actually some atrophy in the brain with hydrocephalus. So, but yet for now we cannot tell if she's going to have them in the future or not. But so we have to wait and see. Because we've seen patients having the same condition and they grew up normally. And this is why this was very important actually for us, because when you do separation surgeries, sometimes you sacrifice one of the babies because one of the babies is better than the other one. But taking this into consideration, we decided that we will take care of both babies at the same time with the same care. And I think all you have to do now is just wait and see.
Remarkable. And is there anything that can be done to support them in terms of, I don't know, physiotherapy or anything of the sort? Or is it too early at this stage?
So, as babies grow month by month, there are milestones that they have to fulfill. And we look at these milestones to check for neurodevelopmental delay or neurodevelopmental adequacy. So all you have to do now is just wait and see. If everything is okay neurodevelopmentally and they are following and fulfilling all the milestones that every normal baby has, then nothing to be done. And we're talking about one baby. The other one is completely normal. Her MRI brain looks very good. But this, the baby B, she has some problems, not problems, I would say atrophy in the MRI that could be normal and might not have any problems. So all we have to do now is just wait and see with time. If there's any delay or problem, then we can start any kind of therapy.
Do you anticipate any further surgical follow-up, or this is the case closed surgically?
From our part, no.
And in terms of the incontinence, I guess at maybe like 2 years or so? Or
it's too early. Yeah, it's too early. We have to wait and see how they develop. I mean, I expect they will have normal continence because anatomically there's no reason why not to. But I mean, only time will tell. We'll have to wait and see. Yeah.
And how are the twins doing currently?
They're doing great. They're growing and they are eating and doing their business, and they're good.
So they're home?
Not yet, because we are very protective of this twin, and we're trying to. But soon. I mean, I expect next week maybe they will go home. Yeah.
Okay. So what does this say about the medical system in Lebanon? I guess Lebanon has been through a lot over the past 3 to 4 years, and despite that, I think you guys have been able to pull a big feat by doing this surgery in Lebanon and not having to transfer the twins outside. So what does this say about the medical system in Lebanon? And I will discuss the challenges afterwards. So what will you say?
We had this economic crisis that we had in this country, and unfortunately, lots of physicians left. But despite all this, and I would talk about AUBMC because this is like the community where I live, and I know my colleagues. We have till now, and I think we will keep on having all the expertise that we need to do all kinds of procedures. we have all the technology that we need to fulfill and tackle every single case that we have. Of course, the surgery department was Dr. Habballah. Was doing a great job in maintaining and trying to hold things together. And of course, Dean Dr. Sawaya and everyone else was working hard for this, and Dr. Fadl Khouri, the president. So at AUBMC, I would say with lots of ease and comfort that we still have all what it takes to take care of whatever cases we have and we're tackling with.
I agree 100%.
It's remarkable that you were able to pull this multidisciplinary team. I know there's been a lot of challenges with the brain drain going on, so kudos to all of the team. Maybe we can spend a little bit of time talking about challenges in the current situation and what can be done to help.
I think with what we have, and it went really well. It went better than I expected, better than everyone has expected, I think. The challenges was just bringing the team together, but it happened smoothly and everyone was very, very happy to help, and everyone was everyone was expert in his or her field, and I mean, they all contributed to the success of this case. Definitely, it's the economic situation. I think the major challenge was for the parents to be able to travel back and forth because they are from far away. They are from the far north of the country, and they had problems coming back and forth to the hospital. And at some point, they were asking for help to do that. As an institution, we were fine. There was no instrument that we needed, but we didn't have. There was no specific specialty that we needed that we didn't have. Everything was available for us, from instruments to manpower. I think we were fine doing this procedure with, I'm not talking about the challenges with the country is living through, from the economic crisis to all of that is definitely affecting every single one of us. But despite all of this, we are able to carry out major surgeries with good and with excellent outcomes.
Great. And so what are the opportunities for the future? I know it's an uncertain situation, but it seems like some of the hospitals in the country are still moving forward. So what are the opportunities in this situation in the future? Not only this kind of surgery, there's opportunities in terms of the medical system, in your opinion.
Yeah, in terms of this kind of surgeries, well, we're looking forward for the next case, and the whole country and all kinds of surgeries. I think we're doing great, and we will continue doing great, because this, regardless of what you're passing through, just put, of course, the determination, and I think in Lebanon overall, at an AUBMC in specific, the doctors and physicians have proved over a period of time since the Lebanese war and even before, that they're able to still perform what it takes for a better society and for a better care.
Do you want to comment on this, or?
I think if we're going to talk about the Lebanon as a whole, we would lie if we say that there's no problem. The country is passing through one of the hardest economic crises that's ever hit the country, and a lot of hospitals are suffering. We're just hopeful. We hope things get better in the country. Fortunately, we are fortunate to work at AUB, and we have all what it takes to do good surgeries and with good outcomes. But we hope that things get better in the entire country as well.
All right, thanks to all of you for being on this podcast. And this was an amazing feat. You guys were able to do a big surgery in Lebanon despite the situation, and the twins are doing well. So that's a great feat. Probably a lot of other places could not have pulled this in the current situation. So thank you very much for being on the podcast.
Thank you.
Thank you. It was amazing. Thank you.